Hello, everyone. My name is Natalie Lascano, and I am the Wellness Coordinator with UF Communications and Work Life. And today I'll be walking you through the Health Education and Literacy Program, better known as HELP. So in this presentation, we are going to identify the three components of health literacy, describe how taking an active role in your healthcare will benefit your long-term health, evaluate sources for reliable health information, define health insurance terms and plan types, and create a plan for future appointments. So let's start with what is health literacy. Health literacy is actually so important that it has become a focus in Healthy People 2030, which is a group of national goals and objectives that are set every decade as a way to improve the health of Americans. And we can define health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. So to better break this down, there are three components of health literacy. There is the ability to obtain appropriate and accurate health information, the ability to understand what this information means for you, and using this information that you have gained to make health-related decisions. Each of these steps builds upon each other, and you can't have a high health literacy level without proficiency in all three steps. Health information is often complex and can contain unfamiliar words or medical terms, but by finding information that makes sense to you and being able to process it, you will be better equipped to make the best decisions for your health. Before we get into each of these steps, I want you to be able to understand why health literacy is so important to your health and how this can directly benefit you and your families. So while this webinar is meant to help you increase your health literacy level, it is important to note that health literacy is not solely the responsibility of the patient. There is an active movement to make health information more easily understandable and accessible for patients. However, health literacy takes effort from both sides of healthcare, from the providers offering better and easier to understand information, and from the patients knowing how to access and use this information. For the healthcare workers that are participating in this webinar, health literacy levels are also an important consideration when you're interacting with your patients. Each patient you see on a given day may be at a different health literacy level. When giving them health information, it is necessary to evaluate where they are and tailor your information to their level. And don't just wait for them to ask questions, actively seek out whatever questions they may have. So why health literacy matters? So even those individuals who read well and are comfortable using numbers can face health literacy issues when they aren't familiar with medical terms or how their bodies work. They have to interpret statistics and evaluate risks and benefits that affect their health and safety. They are diagnosed with a serious illness and are scared and confused. They have health conditions that require complicated self-care, or they are voting on an issue affecting the community's health and relying on unfamiliar technical information. One study into health literacy found that 80% of primary care appointments involve the use of technical terminology and medical vernacular that at least once by the provider, but less than half of these terms were explained to the patient. So you can imagine if you are not in the medical field, or even if you are in the medical field, but you are seeing a specialist who is outside of your specialty, you can imagine how having them throw a lot of jargon and vernacular at you can be very confusing. And oftentimes when we're in these healthcare appointments, we're stressed because being in a doctor's office just stresses us out. So we may not know how to slow down and ask the questions we need to, but hopefully this presentation will help you. So having a lower health literacy level can result in more trips to the emergency department and more health insurance claims. This is often due to being unable to know where you should go for treatment or waiting longer than is advisable to obtain treatment. Lower health literacy levels can also result in less compliance with treatments and medications. If you don't have access to information that explains what your treatment or medication does, you are less likely to use them correctly. This compliance issue can also result in more hospital admissions and the need for more invasive procedures. One study found that patients with COPD, which is a respiratory condition, who had a low health literacy level also had a higher risk of experiencing two or more comorbidities, which comorbidities are additional disease diseases separate from the initial diagnosis. So, for example, if you are initially diagnosed with diabetes, and then 6 months later you go back to your healthcare provider and they diagnose you with high blood pressure, those would be considered comorbidities. And these patients also had an increased hospital admissions or visits to the ER and death than their high literacy counterparts. So you can see how health literacy impacts our health directly in ways that we may not even think about, and it especially affects our health in the long term. So before we continue, I think it'd be really helpful to have an example of low versus high health literacy. So I'm going to walk you through the story of Jane and Anna, starting with Jane. So Jane visits her primary care doctor for a routine checkup. Her doctor notices she recently had a birthday and asks if she's begun experiencing any symptoms of menopause. Jane is not sure what the symptoms of menopause are. She says she has not experienced any symptoms because she still has her period, even though she has recently begun having night sweats and has noticed changes in her weight. Vital screenings done by the nurse show Jane has high blood pressure, and her doctor informs her he is prescribing her medication to lower her blood pressure. He does not provide any education on how Jane can manage her blood pressure through nutrition and exercise, or how to take the medication. When Jane picks up the medication from her pharmacist, the label reads, "Take twice daily by mouth." And Jane is unsure of how many tablets she should take, at what times, and if she should take them with or without food. She becomes inconsistent with her medications, and at her next appointment, her doctor is frustrated that the medication has not worked and increases her dose. Anna, on the other hand, visits her primary care doctor for a routine checkup with a list of questions based on notes she took at her last appointment and a list of all the medications she currently takes. She knows women begin menopause at around her age, so she has searched the CDC and NIH websites for more information on menopause and has listed the symptoms she has noticed herself experiencing. Some of her questions for her doctor are related to managing these symptoms. During her appointment, Anna discusses her concerns with her doctor, and he recommends hormone replacement therapy to help her manage her symptoms. Anna is ambivalent about starting an additional medication and decides to wait on taking out a prescription to do more research at home and consult with her gynecologist to get their opinion on the treatment. Anna has also had trouble with controlling her blood pressure, which she records regularly using the blood pressure machine she has at home. She speaks to her doctor about the dietary and lifestyle changes she has made to lower her blood pressure, and he recommends some additional changes she can make and prescribes a blood pressure medication. Anna asks for clarification on why he wants to prescribe the medication, and he explains he is concerned of the impact her continued high blood pressure may have on her heart health, despite the changes she has made. When Anna picks up her medication at the pharmacy, she asks the pharmacist to explain how she should take the medication, and the prescription label on the bottle itself reads, "Take 1 tablet in the morning and at night with food." The label also includes a diagram depicting a sun and a moon, each with the number 1 next to them, indicating she should take 1 tablet in the morning and 1 tablet at night. So now to review that, how are Jane and Anna's actions different? What supports did Anna have that Jane did not? How could Jane's health have improved with adequate help from her doctor or her pharmacist? How could Jane's health have improved if she knew where to find reliable health information? And do you feel you are more like Jane or Anna when you visit the doctor? Take a moment to think over these questions and continue to think about them as we can move through the presentation. So as a patient, your health is the most important to you, and you need to be your own advocate. You are the one with the greatest interest in your own health, and you know yourself better than anyone. Your healthcare providers have years of schooling, training, and experience to help you, but they also have many patients and can only spend a limited amount of time with you. While they do have your best interests at heart, having an understanding of and willingness to be your own advocate can drastically increase your satisfaction with your healthcare. By being your own advocate, you are accepting responsibility for your own health and becoming an active member of your healthcare team alongside physicians, nurses, and therapists. This results in patient activation, which is where you focus on self-managing your health. As you can see, patient activation is a scale. Becoming more active in your health requires the adoption of new behaviors and skills. Individuals with lower health literacy may lack the confidence and knowledge of how to adhere to and act on their health goals. However, as you move up the scale, you add in new skills which increase your adherence to a healthy lifestyle and to your overall health goals. This eventually results in better use of preventative health services and catching health issues before they become an overwhelming issue. It is important to note that even in level 4, individuals may struggle with these behaviors and skills during times of stress. Health literacy, as we had said before, can be broken down into 3 steps or stages, with the first being your ability to obtain good health information. Nothing else really matters if you are not able to get reliable and accurate information. So where do you typically turn to find health information when you have a concern? Your healthcare provider, online, friends and family? Also, do you ever search for health information for your family members or friends? So healthcare providers continue to be the number one source of trusted health information. This means that it's important to have a good relationship with your provider, to keep up with your regular checkups, your annual appointments, and to have an open line of communication. We'll address ways to get the most out of your appointments with these providers a little later. And of course, with the rise of the internet, more and more people are turning to online sources of information, which can be overwhelming and largely unreliable. However, there are several things you can look at to determine how good of a source the website is and how much you can trust it. First, you need to look at who sponsors the website. Is the sponsor or owner of the website a federal agency, medical school, or large professional or nonprofit organization, or is it related to one of these? A good rule of thumb is to find websites that end in .gov or .edu. By all means, avoid any sort of blog style website because it's most likely unreliable and not checked for validity. And if it is not sponsored by one of these organizations, is the website written by a healthcare professional or does it reference one of the previously mentioned organizations for its health information? And it should also provide links if it is referencing other organizations. So ideally, the information you find should be written by one of the trusted healthcare providers that were just mentioned, although there are other types of researchers who still provide valuable information. Also ask yourself, why was the site created? Is the mission or goal of the website sponsor clear? Sometimes they may be trying to sell you something, so if they are, it's most likely unreliable. You also want to check when the information was written or when the web page was last updated, which you can typically find either at the top of the page or the bottom of the page. This is because medicine and treatments and just our health knowledge in general changes quickly. So usually you'd like your information to be from within the last 5 years to make sure that it is the most up to date and relevant. You should also look at what solutions are offered. Does the website offer unbelievable solutions to your health problems, like a miracle pill or something like that? And do the solutions seem like quick fixes? If the solution seems too good to be true, it likely is. So good examples of reliable information include the National Institute of Health, or the NIH, the Health Finder website, which is sponsored by the Department of Health and Human Services, and Medline Plus, which is sponsored by the NIH and publishes easy-to-understand information specifically for patients. The CDC website also does a great job of breaking down a variety of health topics from COVID-19 to different types of cancer. On a more global level, there's also the World Health Organization, or the WHO. It can also be helpful to look at your state or county departments of health for information that is more personalized to your area. For example, the Florida Department of Health is likely going to have a lot more information related to heat sickness, heat stroke, things like that, because it's Florida. So another important part of obtaining health information is knowing that you can obtain your own health records and how to do this. Accessing an up-to-date version of your health record is important for understanding your diagnosis, identifying questions you may have for your provider, conducting your own research, and providing a full medical history to any new providers you may see. And you can access your health record by going to the provider's online health portal, which is where they upload diagnostic and lab test results for you to view, as well as any notes from your appointment. You can also visit the provider's website, or you can give them a call, or you can visit in office. And then according to the Health Insurance Portability and Accountability Act, or HIPAA, healthcare providers are required to make health records accessible to the patient. You might have to sign a consent form from the provider or the hospital, but it is your right to be able to obtain your own records. And HIPAA also means that your private health information has to be protected from misuse. So after obtaining reliable health information, you need to be able to understand and process it. More and more providers and organizations are working to make health information more accessible and engaging for patients. However, you can seek out information in the best format for you based on how you learn, which might be visual, written, or auditory formats. You can search YouTube. So organizations like the NIH or the CDC or those other trusted organizations that we spoke about earlier, they sometimes create YouTube videos or audiovisual type of things and publish them online on YouTube or on their websites. So if you're more of a visual learner, you prefer videos, that sort of format, you can look there. It is also important to ask questions in this step, particularly with the information that your provider gives you directly. Before you end an appointment, make sure that the information they provided is in a format that works for you and is easy to understand. Also clarify anything you don't immediately understand. You can also ask your provider where you can go to find additional resources for what you've discussed that day. So lastly, to increase your health literacy level, you need to utilize the information you've gathered to make decisions for your health. Most importantly, this includes managing your appointments, prescriptions, and treatment protocols as directed by your doctor. It also entails using your research to assess the risks and benefits of different treatment options to make the best choice for your health. Being health literate will also make obtaining preventative health care and leading a healthier lifestyle in general easier as your knowledge of nutrition, exercise, and primary care improves. Insurance is also an important aspect of health literacy that is often overlooked and complicated by industry jargon. We'll talk more about health literacy and insurance in the next section. So if you have the ability to choose or customize your insurance policy, there are some things to consider. Your financial circumstances and how much you are able to pay out of pocket or willing to pay out of pocket. Your anticipated medical needs, especially if you know you have surgeries or treatments coming up. Your prescription costs. If you have established providers, whether they are in-network, what services are covered by the plan in general, how often you go for healthcare appointments, especially if you see specialists. And even if you don't have the option to choose your plan, it is important to be thinking about these considerations. They can help you plan for the financial aspect of your medical care. Benefits fairs are held annually at UF, usually in October, and are a good source of information of where you can get your questions answered directly. So while we are on health insurance literacy, it is important to know the basic health insurance terms and what they mean. This infographic walks you through a typical health insurance journey. So let's say you're feeling sick and schedule an appointment with your provider. You're usually charged a copay, which is a fixed amount that you pay out of pocket for covered services at the time of care. In some cases, preventative healthcare appointments are free. But for most appointments, you will have to pay a copay. If you have an injury and need an x-ray, you should know whether you've met your deductible or not. If you haven't, you will need to pay for the service out of pocket until you meet your deductible. And your deductible is essentially the amount you pay for covered services before the insurance kicks in and starts paying for you. If you have met your deductible, you will pay a coinsurance. This is a percentage of charges that a member owes for covered services. So for example, let's say you have a deductible of $500 for the whole year. You will have to pay for all of your healthcare services, not just the copay, but any additional fees that a provider might charge. You'll have to pay all of those until you've paid $500 towards your healthcare. At that point, you will then pay a coinsurance for other services that you take out. So if you have many healthcare appointments and treatments, you might reach your out-of-pocket maximum for the year. That is the most you will pay for covered services during a planned year. After this, your plan will pay for all of the expenses for any remaining covered services for that year. So it's also important to differentiate between the different types of health insurance plans. And there's generally three types of insurance plans in the United States. The first one being exclusive provider organizations, or EPOs, which are most commonly offered through the ACA or Affordable Care Act marketplace and usually feature more affordable premiums but higher deductibles and coinsurance rates. With this plan, referrals from a primary care provider are not required to see a specialist, meaning patients can manage their own care. And then there are health maintenance organizations, or HMOs, which limits coverage to care from doctors who work for or contract with the HMO, except in the case of emergencies, and focuses on prevention and wellness. And because of this focus on prevention, HMOs do require you to have a primary care provider and receive referrals from that provider to access specialist care. HMOs are also generally very affordable, especially for those without any chronic conditions or other special medical needs. And finally, there are preferred provider organizations, or PPOs, which do not limit coverage, do not limit coverage to care only provided by in-network providers, but the in-network providers will be less expensive than going out of network. PPOs also do not require you to see a primary care provider or get a referral to see specialists. So these plans are usually best for those with chronic conditions or other special medical needs who may want more freedom in choosing their provider. And regardless of which health insurance plan type you choose, you generally can also choose between a high deductible or low deductible plan. As the name suggests, a high deductible plan requires you to pay more out of pocket for care before your insurance kicks in, and are usually categorized as any plan with a deductible of $1,400 or more for individuals and $2,700 or more for families. This high deductible is paired with a low premium, so your monthly insurance payment is lower. High deductibles are also commonly paired with health savings accounts, or HSAs, which are a special account that can be used to save for certain medical expenses through tax-deductible contributions. High deductible plans are generally recommended for those who are young and healthy and less likely to need anything more than an annual checkup. A low deductible plan, on the other hand, requires you to pay less out of pocket before your insurance kicks in, but also comes with a higher monthly premium. These plans are usually recommended for those who need more regular or extensive medical care, but also have the advantage of being able to easily predict medical costs in the case of an emergency, serious illness, or injury. Before choosing any plan, make sure to review your monthly budget and calculate how large of a monthly premium you can afford and the pros and cons of each plan. So your insurance card, which is provided by your insurance provider, is a great resource for understanding your type of insurance plan as well as your plan's details. If you have your insurance card handy, I recommend pulling it out for this portion so you can identify all the relevant parts discussed in this example. So insurance cards may differ slightly based on the company, but generally you should be able to find each of these sections. The first one being your name, which will usually be beneath the insurance company's name. And this will either be the subscriber's name or the subscriber's name or a member's name, depending on whether you are the person who has purchased the insurance or if you are on another individual's insurance, which they have purchased. Either way, your name should be the first one on the card. And beneath your name, you should be able to find your member ID number. This is basically like your social security number or your UFID number, but for your insurance. It is how you can be easily identified, and it is what your provider will use to bill your insurance. The second section of your insurance card will include either the plan subscriber's name or the names of the other individuals covered under your insurance. For example, since I'm covered under my dad's insurance, his name appears in this section of my insurance card, but on his card, my name, as well as the names of my brother and mom, are included in this section. In the third section, you can find your group number, RxBIN code, and effective date. Your group number identifies which insurance group you are a part of, which determines your specific benefits. RxBIN, as you may have guessed, is a code used to process pharmaceutical claims. Not all insurance cards will include the effective date, which is when insurance coverage begins. This is especially important if you have just switched to a new plan. If it is not listed on your card, you can call your insurance provider to find out when the insurance goes into effect. And then looking to section 4, this is where you can find information related to your out-of-pocket cost when you see a provider. This example also includes several costs in its list, but because it also covers prescription costs, which is not true for all insurances. Regardless, in this section, you can find your copay amounts to see a primary care provider or specialist, a coinsurance rate if applicable, and your deductible. However, the exact items listed may vary based on your card and plan benefits. And, and finally, on this side, your insurance card should also have a label somewhere which indicates whether it is a PPO, HMO, or other type of insurance plan. This example has it listed on the bottom of the card, but it could be placed anywhere. And the back of your insurance card also contains a lot of helpful information. So section 6 contains some fine print information related to your insurance coverage and how claims are processed. And then section 7 lists contact information for your insurance company, which you can call if you have problems or direct mail to if necessary. Your insurance company likely has specific hotlines as shown here, which you can call to find a provider in your network, ask questions related to pharmacy coverage, etc. Next, we'll move on to how to make the most of your healthcare appointments. By preparing for your appointments and following up after appointments, you can take charge of your own care. This will give you more control over your healthcare and ensure that all of your questions and concerns are addressed. Preparing for your appointment beforehand will help you determine what your most important health goals are and what you want to get out of that appointment. This will help you make the most out of the often short amount of time that you have with your healthcare provider. If you have multiple health issues that you'd like to discuss, you can rank them to make sure that you have time to address your most important concerns. Once you determine what your overall goals are, you can start thinking of questions that you'd like to ask your provider. During the middle of an appointment, it can often be difficult to think of questions on the spot, so make sure to take time to prepare for your appointment and give yourself the chance to think of those questions. If you struggle to think of questions or how to phrase them, there are some good resources available, such as the Question Builder from the Agency for Healthcare Research and Quality, which you can find just by Googling Agency for Healthcare Research and Quality Question Builder. This website guides you through the most common questions patients have in appointments and provides you with a printable list to take with you. And then as you can see from the screenshot, it starts with the type of appointment you are having and gradually gets more specified. It is also now available as a free app for your phone. When trying to think of questions, it is important to make sure that they are open-ended as opposed to yes or no questions. These types of questions are helpful with creating a dialogue between you and your provider, instead of the appointment being a one-sided conversation. For example, instead of asking, "Do you think this treatment will be beneficial?" ask instead, "How do you see this treatment benefiting me?" Once you have a list of questions or concerns to address, it can be helpful to write them down and bring them as a list to your appointment. Being at a clinic or office can be a stressful and distracting situation, so having a written list keeps you from forgetting the important things for the appointment and keeps you on track. In order to be an activated patient, it is also important to make sure you have all the necessary background information with you, especially for an appointment with a new provider. Compiling a list of your current medications with the medication name, dosage, and the frequency that you take them can be useful for the provider during your appointment. They'll be able to make sure that any new medications that they prescribe are compatible with what you are taking, and they can also answer any questions that you may have about your current medications. Another useful thing to do is bring a health history. This would include your current health issues, any past surgeries, treatments, or diagnoses, and family health issues if you know about them. A good rule of thumb for your family health history is to go all the way back to your first grandparents, say your grandparents. During the appointment, it is also important to make sure that you are comfortable with and to create a dialogue with your provider. Be clear about what you wish to accomplish with this visit when you walk in and what your most important concerns are. If you're able to, consider bringing a trusted friend or family member with you to the appointment so they can provide moral support and ask questions that you might not think of. And again, try to ask your most important questions first to make sure that these get addressed and you do not run out of time. Write down important information about diagnoses, treatments, medications, and follow-ups from your provider. This will make it easier to reference after your appointment if you still have questions or need to look anything up. And again, bring the medication list and health history that you previously compiled to your appointments and let your provider know about any changes, especially if you see multiple providers from different specialties. It is not always easy for providers from multiple specialties to communicate with each other about a patient, which means they are not always aware of the care plan that other providers have made for you. So it is especially important that you advocate for yourself in this way and make sure that all the information they have is up to date. And before you leave your appointment, be sure to clarify any remaining questions or concerns that you have. There is no question that is too small or insignificant when you are trying to improve your health. So during your appointment, your provider might give you follow-up instructions or refer you to another provider. It is important that you follow up on all these instructions as the offices might not check in with you in a timely manner. And if you have any questions, always call your provider to clarify. And if your question pertains to your medications, consider asking your pharmacist. They can usually clarify concerns regarding dosages and frequency of taking your medication and can advise you on any side effects. Most healthcare providers have also switched to electronic health records, and many are utilizing electronic health portals for their patients. And now, a new feature of these portals is that you're able to speak with your doctor about non-emergency situations directly, like over an email or a text message sort of thing through the electronic health record. It is also where all your medical history and test results will be stored, so it's always important to check on that regularly. And of course, continue to use your health literacy skills and actively seek out more information about your health care. That might include looking treatments and diagnoses up on the internet or finding support groups online. And if you ever feel unsure about what your provider has told you, look into getting a second opinion. It is always your right to get a second opinion. You might have to check with your insurance about whether they will cover an appointment with a different provider, but you should always try. It is also important that you are confident in the decisions you are making for your health. And lastly, continue to work on becoming an activated patient. And to circle back to that patient activation scale, incorporating the suggestions from this presentation into your healthcare maintenance will help you take more control of your health. Being more mindful about the behaviors we've discussed and incorporating them into your healthcare routine will help you better self-manage your health and prioritize your health goals. So some take-home messages are that health literacy is important to improving your long-term health and making sure you get the most out of your healthcare. Health literacy is comprised of three components: obtaining reliable information, understanding health information, and applying it to your health. Insurance is used to prevent financial catastrophe in the case of illness or injury and usually entails a deductible, premium, copays, and coinsurance. Information related to insurance benefits can be found on insurance cards. And finally, patients should always attend doctor's visits with a detailed plan in mind, ask open-ended questions, and follow up with their providers as well. You can also check the UF WorkLife website for more resources, and on the same page where you found this presentation, you can also look at the additional handouts and resources that are available to you there. Thank you and have a great day.